Hello everyone. Today, we're delving into the world of a medication called Naprosyn, commonly known by its generic name, Naproxyn, and various brand names such as Aleve, Anaprox, and Naprelan. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Naprosyn, or Naproxyn, belongs to a class of medications known as nonsteroidal anti-inflammatory drugs, NSAIDs. It works by reducing hormones that cause inflammation and pain in the body. Naproxyn is available in various forms, including tablets, extended-release tablets, and liquid suspension. It's commonly used to relieve pain from various conditions such as headaches, muscle aches, dental pain, menstrual cramps, arthritis, and minor injuries. Additionally, it helps reduce inflammation and swelling, making it effective for conditions like tendinitis, bursitis, and gout. Naproxyn is also prescribed for the relief of mild to moderate pain associated with osteoarthritis and rheumatoid arthritis. It's important to follow your healthcare provider's instructions regarding dosage and duration of use to minimize the risk of side effects. Warnings: Naprosyn comes with its set of precautions. It may increase the risk of heart attack, stroke, or stomach bleeding, especially when used for long periods or at high doses. It's not recommended for use just before or after heart bypass surgery, coronary artery bypass graft, or CABG. Individuals with a history of heart disease, high blood pressure, high cholesterol, diabetes, smoking, or those who are elderly are at increased risk of these serious side effects. Before taking Naprosyn, it's essential to discuss your medical history with your healthcare provider, including any allergies, asthma, liver or kidney disease, stomach ulcers or bleeding, fluid retention, or heart failure. Pregnant women should avoid Naprosyn, especially during the last trimester, as it may harm the unborn baby. It's also not recommended for breastfeeding mothers. Before taking this medicine. Before starting Naprosyn, inform your healthcare provider about any medications, supplements, or herbal products you're currently taking, as they may interact with Naproxyn. It's essential to disclose any allergies, medical conditions, or surgeries you've had. Naprosyn may cause dizziness or drowsiness, so it's advisable to avoid activities that require alertness until you know how the medication affects you. Alcohol consumption should be limited or avoided while taking Naprosyn, as it may increase the risk of stomach bleeding. Regular monitoring and follow-up with your doctor are important to assess the effectiveness and safety of the medication for your specific condition. Side effects: like all medications, Naprosyn can cause side effects. Common side effects include stomach upset, heartburn, nausea, headache, dizziness, or drowsiness. Serious side effects may include stomach bleeding, kidney problems, liver damage, high blood pressure, heart attack, or stroke. If you experience symptoms such as black or bloody stools, persistent stomach pain, chest pain, shortness of breath, weakness on one side of the body, slurred speech, or vision changes, seek medical attention immediately. Allergic reactions to Naprosyn are rare but may include rash, itching, swelling, severe dizziness, or trouble breathing. Interactions: Naprosyn may interact with other medications, including blood thinners, corticosteroids, lithium, methotrexate, SSRIs, ACE inhibitors, and diuretics. It's important to inform your doctor about all medications you're taking to avoid potential interactions. Dosage: the dosage of Naprosyn varies depending on the condition being treated and the formulation of the medication. It's important to follow your doctor's instructions regarding dosage and duration of treatment. The usual adult dose for pain relief is 250 mg to 500 mg twice daily, with a maximum dose of 1,500 mg per day. For arthritis, the typical dose is 250 mg to 500 mg twice daily or 375 mg to 500 mg once daily, with a maximum dose of 1,000 mg per day. Extended-release tablets are usually taken once daily. Dosage adjustments may be necessary for elderly patients or those with kidney or liver impairment. Never exceed the recommended dose without consulting your healthcare provider. Avoid: while taking Naprosyn, it's important to avoid alcohol and activities that require mental alertness until you know how the medication affects you. To minimize the risk of stomach upset, take Naprosyn with food or milk. It's also advisable to avoid prolonged exposure to sunlight or tanning beds, as Naprosyn may increase sensitivity to sunlight. FAQ: many individuals wonder about the safety of Naprosyn for children. While Naprosyn is sometimes used in children for specific conditions under a doctor's supervision, its safety and effectiveness in children under 2 years old have not been established. Always consult with a healthcare provider for any specific queries related to Naprosyn use in children. Closing. That concludes our overview of Naprosyn. Remember, this information is for educational purposes and should not replace professional medical advice. If you have any questions or concerns about Naprosyn, consult your healthcare provider. Thank you for tuning in.